even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're saying a special hi to Ariel, who's listening, who's working his little derriere off in the hospital as an intern. So we want to wish you well and thank you for all the support and the great presentations at the Astro meeting, where you had 2 presentations about radiation and radiosurgery. It's the world's largest cancer meeting, and we, of course, continually update the data, and Ariel's been leading that charge. So thank you. And I want to talk about a patient that we're following now. It's a newly diagnosed patient with an acoustic neuroma. Acoustic neuromas are benign tumors. They're tumors that start on the hearing nerve. As you might imagine, there's little nerves in the brain for smell, for vision, for swallowing, for breathing. These are called cranial nerves. They're among the most delicate and important nerves of one's body, and they come off the brainstem. This man had some hearing loss, which was unilateral, and some tinnitus, which was noise in the ear. And he got seen. He got an MRI, which is a non-radiation test. It's a magnetic wave test with contrast, and he was diagnosed to have an acoustic neuroma. There's different treatments available. One is surgery, where the tumor is cut out. And you may say, great, I want my tumor cut out and be normal, and tomorrow I'll be healthy. The problem with surgery is that most people end up deaf after acoustic neuroma surgery, number one. The vast majority, about 90%, are deaf, and about 50% have facial paralysis, like the whole face fell down. So if you smile, you can't smile on both sides. If you drink a bowl of soup, the soup falls out of your mouth. If you're walking down the street, people may look at you in not the most benevolent way. Whereas with radiosurgery, and our program is a unique program, and I don't overstate that. We were the first in New York to do fractionated radiosurgery. It means that we divide up the dose into 5 fractions. Each fraction is equal. We use the lowest biologic dose, and when we started this program more than 2 decades ago, competitors used to say, oh, it's homeopathic dose, it won't work, you're crazy. Well, we started with a low dose, and we've kept that dose. We haven't needed to increase the dose. So it would suggest, actually, that most everyone else's dose is too high. Because what do you want to do with the dose of radiosurgery? Number one, you want to control the tumor so that more people are successfully treated than you could imagine in other methods. And there's less side effects. And we were the first to report, in addition, hearing improvement. Actually, about 20% of our patients have documented hearing improvement, which was never reported until we went to the International Radiosurgery meetings in Madrid in 1995 and reported that we had a group of patients that actually had improved hearing after acoustic neuroma fractionated radiosurgery in our hands, a unique program. So I met this man. We saw him every time he got treated. After his last treatment, I asked him, how did it feel? And he was funny. He said, it felt like you're just passing a flashlight around my head. I couldn't feel anything. I had no side effects. He did great. Immediately after, he went on a Disney cruise to the Caribbean. He had no side effects. Obviously, he'll be back for follow-up. We follow the tumor with MRIs. We examine the patient. We get hearing tests. He'll have all those things done. But most likely, he'll follow in the footsteps of our other acoustic neuroma patients. As I say, we have the world's largest experience treating acoustic neuromas with fractionated radiosurgery. And most likely, we can't guarantee him. Obviously, there's no guarantees in medicine. But most likely, the tumor will stop or shrink, and he'll continue his normal, healthy life. And that's what we wish for him. Next is an interesting man I want to talk about. 84-year-old man. He's single. He has no children. He came in with a PSA of 24. So normal is considered up to 4. I know there's some controversy about that, but let's just say 24 is high. He had a Gleason 9 cancer. Gleason was a pathologist that would tell us how the cancer would behave based on its appearance under the microscope. Gleason 9 is about as high as it gets. The range is from 2 to 10. So he's pretty much at the top. So he's a high PSA, a high Gleason score. And he shopped around. He looked around for treatment. He was staged up. The cancer has not traveled anywhere. He was seen by a variety of doctors, radiation doctors, surgical doctors. And after he was seen with us, he said he wants to go with our treatment. Now, one reason is the data. And again, if you wish, there's a booklet. You can call us during the work week, Monday through Friday, and we'll mail it to you. But there's actually several charts. And you can see on page 11, graph number 16 and 17 is our data for Gleason 9 cancer. And we've compared ourselves on these two pages to big hospitals in Boston and Philadelphia, and you can imagine which hospitals those are. And our data shows about 125% improved cancer-free survival if you come to us versus going to the other places. But that's not why the man came to us. When I said, well, why do you want to be treated here? I asked him. He said, I want to be treated by you. I said, why? And he said, because you're the first doctor who examined my prostate. Wow. He's been seen by multiple urologists, multiple radiation doctors, and I was the first one to examine his prostate, a physical exam, which I would think would be routine. So he's under treatment. We wish him well. He's going through the process. He's doing great, shows up every day, and feeling fantastic, which is what we want. And from the good news department, we have a gentleman, 56 years old. He came a year ago with his girlfriend, and now he's coming with his wife. And guess what? They're the same woman. Yeah, we have a patient with stage 4 colon cancer. He had a girlfriend a year ago. He was very interesting. He's had rectal bleeding since 2006. For 4 years, he was told by his doctors he had hemorrhoids. But again, no one examined him. Wow. How can you make a diagnosis without data, without confirmation? Doesn't make sense. So there's a long delay. Finally, a physician's assistant told him he has to have colonoscopy, which was attempted to be performed, but it was not able to be performed because by then there was such a big mass in his rectum that the colonoscope couldn't get past it. So he had severe bleeding. He had narrow caliber stools because there was just a small place for the stools to pass in his rectum. He, at that time when he was initially diagnosed, remember 4 years after the blood started, the cancer actually traveled to the liver. He underwent surgery and chemo, and then over the next several years, the cancer came back, and he had surgery and chemo. And finally, he came to us in January with 3 sites of cancer, 2 in the groin and 1 in the back of the abdomen by the psoas muscle. He didn't want any more chemo. He didn't want any more surgery when he heard about radiosurgery. We treated all 3 spots. This is the beginning of the year. And now he's back again with his new wife, in love, and no cancer. All 3 spots are gone. No new spots have appeared. He is happy. His wife is happy. His daughter, who's a student in Manhattan, is super happy. He's doing great, and we wish him very well. And we'll probably report back to you in 3 months. Hopefully another good, healthy visit for this man who is doing so great. Even though he has stage 4 cancer, that doesn't mean you can't be treated. That doesn't mean you can't do great. He's got stage 4 cancer. He's doing great. He's a construction worker, works with heavy equipment, just got married, starting a new life, doing well, and I wish him all the best, of course. And there's a new data off of AP by Lindsay Tanner, who's a medical writer for AP. And the headline in this article is Double Mastectomy Doesn't Boost Survival. Now, many women, and there's an increasing trend, are getting double mastectomies when there's only cancer on one side. Women apparently think that because they have cancer on one side, that if they do both breasts, that they're going to do better. Well, there's data, and actually the data shows that if you just have lumpectomy and radiation, removing the little lump of cancer and keeping both breasts, you're going to live longer. The study involved 200,000 California women treated for cancer in one breast and then followed for years afterwards. The 10-year survival rates were 82% for women who had lumpectomy, but the worst outcomes was those who had both breasts removed. And this is what many doctors have feared. Actually, women who had single breast removed also did less well than women who had just lumpectomy and radiation. So it's another piece of data telling women that removing the breast for breast cancer is not necessary. Removing both breasts does not improve the survival. There's a doctor, Dr. Len Lichtenfeld, the deputy chief of the American Cancer Society, who said, quote, "There's no guarantee by having the second breast removed that you'll do better." The number of women who choose double mastectomies has increased, but they're not doing better. The medical community is trying to understand why this overuse of surgery, excessive costs, obvious deformity, and there's no better results. It's speculated that patient preferences and fear the cancer will return play a role, but the fear exceeds the actual risk. So it's suggested that patients should be given time to absorb a cancer diagnosis, and patients should be educated about treatment options, she writes, the risks and the benefits, before being pressed into decisions about irreversible surgery. And then Dr. Lisa Newman, who's a surgeon in Michigan, University of Michigan, says the results may raise questions about whether surgeons for financial reasons are driving the trend. So there's lots of possible reasons, but the fact remains women do not need double mastectomies for unilateral breast cancer. The results are just as good or better if they have lumpectomy and radiation. Keep that breast. Avoid the big surgery. And remember, women who keep the breast, in my view, have less sad reminders of the cancer, get on better with their life, look pretty much, when properly done, like they looked before. So there's lots to talk about for any woman, and any woman who has a lump in the breast, even if it's not diagnosed, may wish to give us a call. Our number at Radiosurgery New York is 212-CHOICES, 212 246-4237. And we do see many women with lumps